Welcome back to Learn with Professor Janal. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about mechanism of labor. So go ahead, subscribe, and let's get started.
Dear students, before we explain the cardinal movements, first we need to understand the definition of mechanism of labor. So first, we will see what the mechanism of labor means. Mechanism of labor refers to the series of natural movements the baby makes while passing through the birth canal during childbirth. As the baby descends, the soft tissues and the bony structures of the mother's pelvis exert pressure on the baby. Because of this pressure, the baby gradually moves down through the birth canal with a sequence of movements. All these movements together are known as the mechanism of labor. Dear students, now let us look at the basic principles of the mechanism of labor. One important principle is that descent of the baby happens throughout the entire process of labor. This means the baby gradually moves downward through the birth canal from the beginning until delivery. Another principle is that whichever part of the baby comes first and meets the resistance of the pelvic floor will rotate forward. This rotation continues until that part comes under the symphysis pubis. Finally, whatever part of the baby comes out of the pelvis will move around or pivot under the pubic bone. These principles help the baby adjust its position so that it can pass through the birth canal more easily. Dear students, before discussing the steps of the mechanism of labor, we should also understand the typical conditions in which this mechanism occurs. Normally, the lie of the baby is longitudinal, which means the baby's body is aligned in the same direction as the mother's uterus. The presentation is cephalic, meaning the head of the baby comes first during delivery. The position is usually right or left occipito-anterior, which means the back of the baby's head is directed towards the front of the mother's pelvis. The attitude of the baby is one of good flexion, where the baby's head is bent forward so that the chin is close to the chest. In this situation, the denominator is the occiput, which is the back part of the baby's head. The presenting part that first enters the pelvis is usually the posterior part of the anterior parietal bone. These features help the baby pass more easily through the birth canal during labor. Dear students, now let us move to the main movements of the mechanism of labor. The first movement is engagement. Engagement means the baby's head enters the pelvic inlet. In a primigravida mother, this usually happens during the later weeks of pregnancy. But in multigravida mothers, engagement may occur only a few hours before delivery. In a normal vertex presentation, engagement occurs with the suboccipito-brygmatic diameter of the baby's head, which measures about 9.5 centimeters. We say that the head is engaged when the presenting part of the baby reaches station 0, which is at the level of the ischial spines of the pelvis. This indicates that the baby's head has properly entered the pelvis and labor is progressing. Dear students, the next movement in the mechanism of labor is descent. Descent means the downward movement of the baby through the birth canal. This process occurs throughout labor. It is usually slow during the first stage of labor, but it becomes faster during the second stage. During the first stage of labor, the contractions and retraction of the uterus help the baby gradually move downward. Later, when the membranes rupture and the mother starts bearing down during the second stage, the descent of the baby becomes more rapid. This continuous downward movement helps the baby progress through the pelvis towards delivery. The next movement in the mechanism of labor is flexion. Flexion occurs when the fetal head meets the resistance of the pelvic floor during its descent. Because of this resistance, the baby's chin is pressed towards the chest, causing the head to bend forward. When the head flexes, a smaller diameter of the baby's head presents to the birth canal. This smaller diameter is called the suboccipito-bregmatic diameter, which measures about 9.5 centimeters. Before flexion occurs, the diameter presenting would be the occipitofrontal diameter, which is larger and measures about 11 centimeters. So, flexion helps the baby pass through the birth canal more easily by presenting the smallest possible head diameter. The next movement in the mechanism of labor is internal rotation of the head. During this step, the occiput, which is the back part of the baby's head, rotates about 1/8 of a circle, which is approximately 45 degrees. As this rotation occurs, the sagittal suture of the baby's head moves from the transverse or oblique position into the anteroposterior diameter of the pelvis. This movement brings the occiput forward towards the symphysis pubis. Internal rotation is important because it helps align the baby's head with the shape of the pelvis, allowing the head to pass more easily through the birth canal. The next movement in the mechanism of labor is extension. When the baby's head reaches the vulva, it meets the resistance of the pelvic floor. Because of this resistance, the baby's head starts to extend. During the stage, the occiput remains under the symphysis pubis and acts as a pivot point. As the head continues to extend, crowning occurs. Crowning means the fetal head stretches the vulva and remains visible at the vaginal opening without going back inside. At this point, the smallest diameter of the baby's head passes through the birth canal. With further extension, the head gradually emerges, and finally, the baby's head is delivered.
After the baby's head is delivered, the next movement is called restitution. In this step, the baby's head rotates about 1/8 of a circle to realign with the shoulders. This happens because during internal rotation the head had turned separately from the shoulders, and now it returns to its normal alignment with the body. After restitution, the next step is external rotation. During this movement, the baby's shoulders rotate to come into the anteroposterior diameter of the pelvic outlet. As this happens, the head also turns slightly outside. In this position, the anterior shoulder lies behind the pubic symphysis, while the posterior shoulder lies over the perineum. This rotation prepares the shoulders for delivery. The final movement in the mechanism of labor is expulsion. In this stage, the shoulders and the rest of the baby's body are delivered. First, the anterior shoulder comes out from behind the pubic symphysis. After that, the posterior shoulder is delivered over the perineum. Once both shoulders are delivered, the rest of the baby's body follows easily by lateral flexion. This completes the process of delivery, and the baby is fully born. Dear students, with this we have completed the explanation of the mechanism of labor and its main movements. I hope this session helped you understand the steps clearly and in a simple way. Thank you for watching this video. If you found this explanation helpful, please like the video, subscribe to the channel, and share it with your friends and classmates. Also feel free to leave your comments or questions below.